Herbst, Vice President of Mental and Behavioral Health for Children's Wisconsin, Maria Perez, Vice President of Behavioral Health for 16th Street Community Health Centers, Representative Paul Tittl, Chair of the Assembly Committee on Mental Health and Substance Abuse Prevention. The representative is having some issues with video, so I think for now is going to just call in to today's webinar. And last but not least, Sean Kirkby, Senior Editor of Wisconsin Health News, who will be moderating today's event. Before we get started, I want to make sure we thank our generous sponsors of the Wisconsin Health News virtual series. These important discussions truly would not be possible without their support. So a huge thank you to Advocate Aurora Health, AARP Wisconsin, Anthem Blue Cross and Blue Shield of Wisconsin, Gunderson Health System, Hush Blackwell, and Quartz. And I want to give an extra thanks today to AARP Wisconsin, today's featured sponsor. Wisconsin Health News is an online, nonpartisan news service. In addition to hosting events like these, we also publish an email newsletter. If you're not yet a subscriber, I encourage you to sign up for a free trial, which you can do so at our website, wisconsinhealthnews.com. With that, I'm going to hand it over to Sean to lead today's discussion. Take it away, Sean.
Thanks, Tim. So in his State of the State address in February, Governor Tony Evers declared 2023 the year of mental health. Both he and Republican lawmakers have called the status of mental health in Wisconsin a growing crisis. And our panel today will take a deep dive into this issue and talk about some of the ways to address this. And I guess I wanted to start off first with Linda. The Office of Children's Mental Health releases a report each year with data on how kids are doing. What is the status of children's mental health in Wisconsin? And are there areas where folks are faring poorly, and where are areas that we're doing well in?
So thank you, Sean. I appreciate that you are covering this important topic. Unfortunately, Wisconsin's children are not doing very well in terms of mental health and well-being. We know that 1 in 5 kids are engaging in self-harm. 1 in 4 girls are seriously considering suicide. 1 in 3 feel sad and hopeless every day. And at least 1 in 2 are feeling anxious every day. In addition to that, we know that kids are not feeling like they belong at school. Most of these trends have started well before the pandemic, but they're exaggerated by the pandemic, especially the belonging at school. And they're all really serious in terms of, the overall mental health of kids. What can we do? This didn't develop overnight. There are many things that we can do. Our office is concentrating on increasing the connectedness of youth, because connections are like vitamins for the brain. Kids need to be connected, and there are lots of ways that we can work on that. There are things that we need to invest in ongoing sustainable funding for mental health, especially school mental health, where 75% of kids get treatment, if they get treatment at all. And we need to also, as in communities and as parents, as adults, we need to model good mental health. And that is a number of things, supporting kids to get the sleep that they need, supporting them to be connected at school, to be involved in extracurricular activities, and modeling putting down cell phones and screens and walking away from them, so that your brain can get other kinds of interaction, and you can develop relationships that are going to help you develop into a strong, committed young adult.
So Linda, can you talk a little bit, what are we seeing in terms of disparities in terms of, access to mental health care? Is it more difficult in some parts of the state to find care, or certain populations that are struggling more to receive it?
Yes, thank you for that question. Yes, we know that kids of color, Black and brown kids, have a harder time getting access to care. Certainly, I'm sure Maria can speak to this, access to care with culturally sensitive therapists. Of course, we don't have enough therapists or mental health professionals throughout the whole state, so that's an issue. Kids in rural areas have some more difficulties because of the distances they need to travel to get mental health coverage. All of the, we know that kids who are LGBTQ are experiencing a lot more stress if they don't have, especially if they don't have a supportive adult in their lives.
Hi, Dr. Perez, could you just sort of talk about, I mean, what are you seeing among 16th Street's patient population, and kind of what are kind of the trends that you all are seeing?
Yeah, thank you for the question. And some of what Linda was saying just now just really echoed with my experience here at 16th Street. Even pre-pandemic, we've been very busy in behavioral health with anxiety, depression, punctuated by loneliness and isolation with that pandemic. So what we've been seeing also is an uptick not only in demand and need for appointments, both non-psychiatric and psychiatric appointments, but certainly more patients struggling with substance use disorders. So we've just been seeing an uptick overall, certainly since the pandemic, but the actual problems themselves, Sean, haven't really changed. They've been punctuated, I would say, by the pandemic. But really that loneliness, we're seeing just a lot of people who are just disconnected, children and adults alike. So that's what we're seeing here, and we're very busy. And again, some of the other questions you will have later this morning or this afternoon will speak to the how this affects access. But that's what we're seeing in community health here on Milwaukee South Side.
Got it. So Amy, what are children's and other health systems kind of seeing in terms of mental health demand?
Sure. Thanks for the question specific to kids. So much of what Linda and Maria stated is true for kids. So we saw our call volumes triple and the demand for services grow really at an alarming rate between 2019 and 2021. And then also we saw our volumes in the emergency department. They went up by 40% since 2020 for kids that were coming to the emergency department for mental and behavioral health concerns. And then also in the emergency department, we saw the volumes for kids that had a suicide attempt. Those volumes, we saw a 60% increase for patients who had attempted suicide. During that time frame during the pandemic from 2020 to 2021, which is terribly concerning for us, as you might imagine. And then almost a year ago to the date, we opened the Craig Yabuki Mental Health Walk-in Clinic. And we see kids in the walk-in clinic just based on what they determine their need is. So they get to decide if they're having an urgent mental health care need, and based on their own determination, they're able to just walk in without an appointment, without a referral. And what we've seen is that 54% of those kids that we've seen do not have an established mental health care provider. So that's really concerning to us because those kids could be benefiting from access to a mental health care provider that could maybe be preventing that urgent mental health care visit if they had that access to care, to Maria's point, but they don't have that access. And that really ties back to the struggles all of us are having around the workforce. We have got to solve this workforce shortage. And we need to solve it now so that kids can receive that access to care that they deserve, which again will help later in life as adults are going to be needing that access to care as well.
Got it. And I want to get into solutions in a little bit, but I also want to circle with Mary Kay. Can you just sort of talk about what you're hearing in terms of mental health needs across the state, and how does the mental health needs of adults compare to those of children?
Well, thank you for having this conversation today. It's really important. As you can hear, the statistics are staggering. The healthcare needs that we're hearing in our office is really no different than children for adults. The number one thing is the workforce. We're having moms call our office to say that they've got an appointment in 9 months for their son who just had a suicidal attempt in a hospital. And as a mom, if you're taking that child home and you have to wait 9 months to see a provider, that's that's unsurmountable. That's something that you will carry and will create more stress. And so some of the solutions we feel, of course, are to increase providers. We need to come up with a plan to educate people as they're learning, earn while you learn, kind of career ladders for people in all of the healthcare systems. We need to find ways to expedite licensures for social workers and others. There's a huge delay in our state, and it's a problem that's low-hanging fruit that we could solve that problem if we could move that process forward. I know Representative Tittl has a few ideas on getting more psychiatrists to the state. We have just a huge shortage of psychiatrists, and the child psychiatry is very limited in the state of Wisconsin, so that makes it even more difficult. So for us, the access to care and the access to crisis services, we are very concerned about the crisis service system right now. I like to say we can either pay for it now or we can pay for it later. And if we would invest in our community services, our child youth services, and increase that, it will decrease the amount of crises that will occur, but people can then walk in and get the support they need. My daughter lives with a mental illness, and it's been difficult. She's moved back into the state, and just to get an appointment, to have those access clinics like they have in Milwaukee where someone can get quicker care would be really helpful, because when people call our office and ask for support, and our first statement is, the earlier you get here, the better the outcome. It's really hard because there's not a lot of people to call to get the care from right now. So we just have to solve that problem.
Got it.
My audio is on now, isn't it?
Yes, you are here, Representative Tittl, and we can
Okay.
hear you. Great. And apologies just for the little bit of a late start. We just had a few technical difficulties to work through. And Representative, I was wondering, can you sort of talk a little bit about what you're hearing from your constituents around this issue as, chair of the Assembly's Mental Health Committee? What are some of the access issues that you've heard?
Well, I think it's been talked about before, but I think the number one thing is access to providers. And we have been working on this one particular bill for four consecutive sessions now. And that is access to get more psychiatrists to practice here in the state of Wisconsin. As we are working with that, we always run into a certain amount of resistance, because people don't want to spend the money to do it. And I keep telling them, I go, well, fine, then we'll pay $55,000 a year and house them a different way, and we'll house them in our prisons. And I think I'm starting to get through to some of these people, understanding that it's like, if we don't help them, especially the younger kids right now, they will become our future, and our future may be paying for their room and board at our state prisons. And, when you have 80% of the women that are in prison that have a mental health condition, or 50% of the men in our prisons have a mental health condition, you don't have to look very far to see where we house most of our mental health patients in Wisconsin. It's in our prisons. The psychiatry bill, we've further expanded it now to nurse practitioners that practice in mental health. Again, this is not just for blanket doctors or blanket nurse practitioners, but these are people that practice in the mental health field. They would get a tax incentive of up to $200,000 if they practice in an underserved area. And underserved area is defined by the federal government, it's not defined by us. And up to $100,000 in the first 5 years of income could be tax-free if you practice anywhere in the state of Wisconsin. And I think it's very important that we maybe attract some psychiatrists here that we wouldn't normally attract. And quite honestly, if we steal them away from Missouri, Illinois, Iowa, Montana, I don't care where we steal them from, but I want to help the people of Wisconsin, because as somebody was talking, I think Mary Kay was talking about that, where you have someone that finally agrees to get the help that they need, and then they have to wait 9 months for an appointment. I had a tragic story of a young man from Milwaukee. His father came to see me. Another rep asked me, it's like, would you meet with this guy? And I said, sure. And I met with him, and he was actually down at the Capitol on the day that his son would have had his first appointment. But unfortunately, in between time, he completed his suicide. And I mean, I don't even know, as a father, I don't know that I could have even went and met with anybody, let alone met with the chair of the mental health committee on the day that my son would have possibly got his first step towards getting the help that he needs. And so we are working very diligently with on that bill. We're also working very diligently on another one, which would be enhancing TAD funding. Now, TAD, in case you're not familiar, is treatment alternative diversion. We have drug courts, we have veterans courts. But right now, if you wanted to start a mental health court, and there are some going right now, I have personally sat on the bench with the judge up in Green Bay and sat with him the entire day on his mental health court. And it is a great way to learn about what's going on in your community. Even though Green Bay is not in my community, I wanted to see what that is, because my community in Manitowoc County, there is a group that want to start a mental health court. And there's more accountability for it, but it takes a lot of work, and they need funding. And the funding, this TAD funding is applied for by grants through the Department of Justice. And this would allow that anybody that wants to start a mental health court to apply. You know, when you're applying for these grants, you obviously have to have a plan, and they would have a plan for mental health, because if you want to know who's suffering with mental health conditions, other than seeing a psychiatrist in your community or a psychologist in your community, talk to a police officer, because they know exactly who is suffering from mental health. And and the police are very tuned in on this mental health court when I was up in Green Bay, and they are very aware of what's going on. And I think them are just two things that we're working on to try to get more help for people in Wisconsin. I think short of providing getting more providers here in Wisconsin, we're going to see the same old over and over again. And there are some people that don't like my psychiatry incentive tax bill, because, well, what other states have done it? Well, no one. This one came to me on the way home, driving from Madison to Manitowoc one time. And I just said, we incentivize companies to come here. We incentivize doctors to, get their, some of their college bills paid for. We incentivize all kinds of different things. And yet we should incentivize people to come here to help our people in Wisconsin. So I think a lot of people are realizing that affects more than just, our tax numbers. It affects people, families, it's affecting a lot. I'm sorry, I'm going on, but you know what? I waited a long time to get on this soapbox, so I might as well take it.
Yeah. Well, thank you, Representative Tittl. Linda, I want to circle back to you. So Representative Tittl was talking about the challenges with workforce. And I guess when it comes to children's mental health, is that kind of one of the main challenges right now, is having this robust workforce to take care of kids? And if so, what kind of changes and solutions do you see needed to kind of boost the ranks of those providers?
Well, yeah, it's central to the problems that we have, is that there are not enough mental health professionals in any part of the state to address the demand that we have right now. Some of the things that we see can help this situation right now is funding school mental health, where schools are collaborating with the community mental health providers that are available to come into the schools and do work with students and with the school staff. And that generalized learning helps them to deal with more kids. Where we would like to see all of the health plans pay for qualified treatment trainees. So Mary Kay mentioned earlier that, you know, to be paid while you're earning your hours is important. We have some health plans that don't pay for qualified treatment trainees. Those are people with a master's degree and some experience, but they don't have licensure yet. We also have some insurance companies that don't pay for anything in terms of school mental health. And school mental health is not a long-term answer, but you know, I have to look at this situation on kid time. And on kid time, we got to do some stuff right now. And this is where I see that investing in school mental health, the money the legislature has and the governor haven't put in it before have made a difference. We have more going on in schools, but we need to provide sustainable ongoing funding so that the schools and more schools can get in place the kinds of treatment and activities that will support kids. Another strategy, I'll just add one more thing, another strategy that we are focusing on this year is increasing youth voice about what works for kids and supporting programs like Sources of Strength, NAMI Raise Your Voice, the youth-led programs in schools that help kids understand, have, you know, some mental health literacy. They understand mental health. They know what resources are available at their school, and they feel equipped to help their peers, because we know that that's where kids go first with their issues, as they talk to their friends. We also know that the quality relationships among teens are critical to how they fare as adults, even in some cases more critical than their relationship with their parents. So we want these kids to become more mental health literate. They're already willing to talk about mental health. We want them to have more resources so that they can become the kind of support to their friends at school that will really help them right now while we're solving this longer term professional crisis.
So to follow up on that, Linda, the governor's budget puts a substantial investment into school-based mental health and makes permanent a program that was funded by COVID-19 relief dollars to support those efforts. Is that something that you think could help here? Is that a provision that you support? And can you kind of elaborate on what the impact of that could be? Is it enough, you know, funding for this work?
Yes, this is very important. The governor is proposing that we make permanent the funding for the Get Kids Ahead initiative that's been funded by federal pandemic funds. And he's also proposing that we make the funds for mental health in schools into a longer term program than it has been. Right now, most schools are depending upon school mental health grants that they have to keep reapplying for. And so it takes their time away from education. It means that they can't know for sure whether they're going to have funding. And most importantly, it means that they don't have funding to hire the social workers and the other support staff that help to keep everything going, help to keep the school mental health program going. So yes, those are very important and at the top of our list of things that should be done for children's mental health this year.
Thanks, Linda. Amy, I know that you're involved with, or Children's is involved with some of these school-based mental health services. Can you just sort of talk about their impact? And I mean, what kind of initiatives or efforts do you see needed to kind of further support providing this type of care?
Yes, we're very involved in school-based mental health, as are many organizations around the state, and there'll never be enough of us. It's an excellent way to remove barriers to access. And that's one of the reasons why we went into the schools. So it creates an opportunity for kids to have access to a mental health provider without having issues around transportation. So you can just walk down the hallway and see your therapist. The other opportunity that you have is that you can reduce stigma. So, you know, you have kids in the hallway who might see their therapist, and they'll often say to their peers, "Oh, that's my therapist," and they talk about it as if it's as if it's nothing. And that matters tremendously because kids are doing a really excellent job, and adults can take their lead and learn from kids who are talking about mental health just like it's health, and that matters. And when you have therapists in schools, it allows for an opportunity to change the culture in the school as well, because there's time for therapists to engage with the administrators and with the teachers, and to have time for consultation and conversation so that you can start, those teachers can start learning about trauma-informed care and learning about mental health, and seeing kids differently. And understanding their behaviors differently, so that they might see them less as a problem or problematic, and see them more as needing some assistance and some understanding, and having some tools to engage with them differently. And that can change the trajectory of their education, and then ultimately of their lives. So there's some major benefits to bringing mental health into the schools. Where kids are. Going to where kids are is the way to get this done. And Linda is right in everything that she said. The money that the governor has put into school-based mental health is critical. Setting it up as grants makes it challenging for many schools and school districts. And Sean, there is one thing that I want to add to Linda's point about the qualified treatment trainee therapist fellowship program. Just from a very practical standpoint, it's something Children's has made a big commitment to, and it does make a difference in terms of access to care. And I just want to put some numbers to this. So in 2019, we launched our qualified treatment trainee program, and as of right now, we've had 15 therapists complete the program. And of those 15 therapists, 10 of them have received their license. And I'd love to talk about licensure opportunities. And for those 15 therapists, what they were able to do while they received robust training and supervision is they were able to provide therapy to nearly 4,000 families who would not have otherwise received that therapy. They would have sat on a waiting list more than likely. They also provided to those 4,000 families nearly 30,000 therapy sessions. So there is significant value in that commitment. And we're really grateful for the funding that was provided, the legislature that Representative Rohrkast and Nygren and Senator Darling, who were all involved in that effort, and UW-Whitewater for their involvement in that too. More than 50 agencies have received that funding. And so take the numbers that I shared from Children's Wisconsin, add to that the other agencies involved, that had a tremendous impact on access to mental health care and developing the workforce that we need. And we need to be able to have those qualified treatment trainees practice in schools and be able to bill for their time when they are in those schools.
And so, Amy, you mentioned some licensing things you'd like to see, and you mentioned earlier also the challenges around workforce. And I guess, can you broadly talk about what you would like to see in terms of solutions to kind of meet those twin challenges?
Sure, absolutely. And I'm sure everyone else could add to this too, so I'll try to be quick about it. So a couple of things. We have lost some applicants because of licensing issues, and there are a variety of reasons why there have been licensing issues. But the bottom line is that we have lost applicants, and we can't afford for that to happen. There are not enough providers. Every applicant that we've lost because of a licensing issue is one that we couldn't afford to lose. So we've got to address those issues. Now, I will say there have been some solutions that have been helpful. So Act 10 licensure has been helpful, and we're grateful to the Wisconsin Hospital Association and others who worked on that in the legislature and with the governor signing into law that granted that temporary licensure for our providers. That made a difference, and that allowed providers to be able to practice, which then provided access to mental health care to our kids. So that was a solution to the licensure problem. And we continue to be encouraged about where things are going with the new bill that was announced last week by Representatives Sortwell, Gobin, and Senator Cabral Guevara, that would expedite the process for getting new healthcare grads into the workforce faster. And it would allow the employer and the candidate to have an attestation process. And we are in support of that. We spend a lot of time with these new grads in terms of their training and their education and their supervision. And there is some risk associated with this, but the risk is low based on that time in terms of supervision and training and education. So licensure issues are real and they are a barrier, but these are some solutions that have proven to remove some of those barriers. And now this new bill is another step in the right direction for us. So I see that as opportunities to be able to solve this problem.
Thanks, Amy. Dr. Perez, can you talk a little bit about how robust are community-based services for mental health in Milwaukee and Wisconsin? What do you see as needed to further support them?
So I thank you. This is a great question. Of course, I'm a very big fan of community-based services and CHCs, community health centers in general. Those models of care really open doorways for the communities that we serve. Part of this has to do with implicit trust that community members have in those community-based services. And I think I'm kind of answering it in two different ways. Community-based services, meaning, the uprising comprehensive community services, the CCS programs that we are glad to see launching now and moving along quite nicely across the state and Milwaukee County in particular. The trust is really important, and the rapid access is really important. And those models are gaining momentum, thankfully. And I think that because they are embedded in the communities, so not only trust and rapidity of access, people are much more comfortably accessing those services that they need. And in particular with CCS, I just want to make mention that CCS makes it possible for community members to access therapeutic activities that they would not otherwise have access to. So namely equine therapy, yoga, and those kinds of things that are very therapeutic, not to mention care coordination and case management. So I think that if I may just say that, yes, these needs are stark, and we have every right to be concerned, especially in the area of workforce and children, the services for children. But on the other hand, I see evidence that there are so many efforts in Wisconsin that are trending us in the right direction, because I think the right people are at the table. I see a lot more collaboration and camaraderie amongst agencies, more involvement with stakeholders, policymakers. Those are really, really encouraging for me in my role, not only at 16th Street as the VP, but the chairwoman of the Mental Health Board. I love to see greater collaboration and community involvement, and communities speaking into what is needed. That's also very important. So any efforts that are made that invite community members to have a voice, I think that's very, very important. So I think that, yes, this is an important conversation because we have every right to be concerned, but let's also be optimistic, because there's some really, really good stuff going on in Wisconsin that are indicators that there's some light shining in through those dark clouds.
So 16th Street serves a predominantly Latino population in the south side of Milwaukee. Can you just sort of talk a little bit about some of the challenges in terms of finding providers offer that care and making sure that folks are offering culturally competent care?
Thank you. Good question. So we have, and the numbers may have changed, but perhaps up to 70 to 80% of our patients are either monolingual or bilingual, but we certainly are seeing a growing number of other, ethnicities in our clinic. So, the challenge, I think, as you're alluding to, is it's hard enough, these workforce challenges, right? Because we all need providers in mental health care, whether they see adults or children. And then add to that the additional need of finding bilingual providers and culturally competent providers, right? You can be, and thankfully we've been very blessed. I have a team of up to 62 providers, give or take. And I'd say a good maybe 70% of them, 70 to 80% of them speak Spanish. And those who do not speak Spanish, they have a lot of support internally with multicultural competency and diversity training in-house. But the challenge of finding bilingually and culturally competent providers is always an added layer of challenge. One way that we are addressing this is we tend to attract students from the universities who happen to speak Spanish, and they want to come and work in community healthcare, which is wonderful because we have medical services, HIV, social services, and they get exposure to a broad array, not just mental health. And then, of course, have the opportunity to work in our child and adolescent day treatment program. We train them there. And so we have about 4 QTTs right now in the schools. So I think that these are ways that we're trying to address it because the challenges are very real, right? We've been fortunate to hire I think nearly all of our QTTs except for one, and we get a fresh lot every semester or so. But yes, it's undeniable that when you add that language barrier, that adds a added layer of challenge. But I think it's really important to leverage the expertise that we have not only in-house, but continue to support. We support our providers, for example, in continuing education units or continuing education credits so that they can get those CMEs. And we strongly encourage and ask deliberately how they are supporting that multicultural competency component that you speak of.
Thanks, Dr. Perez. Mary Kay, wanted to switch to you. Can you just sort of talk a little bit about what you all are supporting in terms of policy change, and how do you see what do you see as ways to close some of these gaps and ensure that people are getting the care they need?
Thank you. I just want to say, Maria, I've toured 16th Street and we visited with the health services. Milwaukee really is a positive place right now. And one of the things that is your community has come together with the mental health committee and really done some great research. Unfortunately, we look at the state from 72 counties and not all those counties have those services. I know we have some bright lights. Green Bay has some, Fox Valley has some. Really bright lights of the community coming together to provide services for their not only children but also their adults. So I applaud your positive enthusiasm, but we also have some counties that really need the help and support that they don't have because they're in such rural communities. But to answer your question, Sean, sorry, we are focusing this year on a lot of the crisis services because of the national 988 bill that went through. We now have a national call center where people can call 988 if you're in a mental health crisis, and as a person dealing that mental health crisis or a family member, you can call that number 988 and they will connect you with your county services. We need sustainable funding for that. It is working. It's getting a lot of calls. Most crisis calls are resolved by connecting people to the community through that. And so again, pay now or pay later. So pay now would be to continue to sustain that 988 system. Right now it has an ARPA funding and it needs to be sustainable. Also some place to take people. So we need some crisis centers to take people. Right now, way too many people are being taken to Winnebago when they're in mental health crisis. It is over capacity, understaffed, and a horrible way to treat people, to put them in the back of a police car and cart them across the state to Winnebago. We needed a different, more humane medical response instead of a legal response. And then we want to obviously increase community services as well for people so that they don't get into that crisis. And several of these things are in the governor's budget. I know that we would like for it to be looked at and analyzed. But also, I would say one of the things I'd love for the legislators to really look at is our Chapter 51. It is an antiquated law that needs to be revisited, and there's some things on that that would really help with our crisis services and overall services to mental health and community. And I think we have lots of people, as Maria was talking. This year, I've just been amazed at how many people are coming together. Providers, law enforcement, ourselves, and NAMI, Linda, Office of Children Mental Health, and all of us are coming together saying this system's not working. We all need to look at it. And I don't think anyone agrees that it's working very well, but I think everyone, of course, has ideas of how it would work better. But we need to really use evidence-based, clear services that we increase the care and health care that we give to these people. Unfortunately, so much talk about mental health is linked to the legal part and the criminalized part. And I really appreciate Representative Tittl's view on mental health courts. I'd like to see that, and your statements about people in jail and prison. And while that is true, I would like for us to have a medical response for those folks so that we're not linking people with a mental illness and being in jail. That's a sad link. We shouldn't have to have that link, but I understand why it's a conversation, because it's true. It's a true fact. And I just really like for us to focus on giving medical help, medical help to people for a medical condition. And so those are the things that we're focusing on and would like to see as a part of this process.
So one thing that came up from audience questions, Mary Kay, and I was wondering if you could lay in on this, is what role can peer support specialists play here? And is there other things that you see needed to kind of grow that workforce in the state?
Yes, thank you. That's an excellent. I have a note here. I wanted to say something. Two things. We've been talking about workforce. One thing I just want to reemphasize. I know a whole lot, and people in this on this computer screen know. I know tons of people who have a social work degree, a psychology degree. Heck, I even know some psychiatrists who are not working because reimbursement rates are so low in the mental health world. If we could increase reimbursement rates, that would be great. A part of increasing the workforce for a lot of these things, having a certified peer specialist is something that's proven to work very effectively. It's less costly. Those the training is less, but there is a certification process. It is worked with people with mental illness. We have them in the respite seminars. We have them in respite care, and we need to have the ability to reimburse those people for the work that they do and increase our ability to expand that, especially in the rural communities that we have service providers in that area. I know on our mobile crisis response, we would like to see more certified peer specialists on those mobile crisis response, again, to make it less of a criminal legal issue and more of a humane response to people that are in mental health crisis.
Thank you, Mary Kay. Representative Tittl, there's been some conversation here about some of the provisions that are in the governor's budget. What's your stance on the mental health provisions in the governor's budget? Are there things that you support in there, and do you see that moving forward?
Well, I guess it would depend upon which provision you're talking about. And I would say that I'm for supporting just about anything that will get more access to mental health. And Mary Kay, I apologize if I don't want to classify everybody that is, has a mental health condition is going to go to prison. I don't want that, but I would tell you that, there is I think a growing amount of support coming out of our legislature, understanding about investing into mental health. And I think, and I'm hoping, I don't serve on joint finance. I don't know what they're going to come out of there. Depends upon if their policy changes. If their policy changes, generally they remove almost everything of policy out of the budget. And I would assume that we're going to invest more into our kids' mental health in schools. It's only a few years ago We have, well, next week, Tuesday, we have a hearing in our mental health committee. We invited different speakers in, including Linda, and there's, different people are going to be there. We've invited them in, and one of the things that came out of one of these hearings was that if you wanted to have mental health services in a school, you had to license each school as an offsite clinic. I don't know if you remember, some of you maybe weren't around back then, but that was just insane if you ask me, because why in the world would you license every school if you were a healthcare provider like a Bellin or an Aurora or a Freighter? You're going to have to license every single school with the state of Wisconsin and then provide separate record areas, separate, counseling areas. And we said, no, if you're a licensed professional that you want to provide services within our schools, if the school district okays it, let them do it. One of the questions you talk about is stigma. That I think stigma is on the downswing. I hope, there's a certain amount of stigma that'll stay with mental health, I think, at all times, but we need to reduce the stigma because it's not bad to have needing of mental health, and I know a personal family member of mine when I visited, and the other mother of the family member that I visited just was in tears because nobody else from the family was visiting. There's a certain stigma about mental health, and we need to do our best to reduce that. And every chance I get to talk to a group, and I know this is a little bit off subject, but I want to turn it into the casserole disease. And people say, well, what do you mean by a casserole disease? Well, recently I had, 3 back surgeries, and I had friends that came over, brought a casserole, brought a pot of soup or whatever, so my wife could concentrate on taking care of me. And, they brought over a casserole for us to eat. We don't do that with our mental health patients, and we should. Let's turn it into the casserole disease, where we embrace the family members that are going through the mental health crisis, rather than, not going there because you don't know what to say. Well, you don't have to say anything, just show up. And I think that's one of the things that, as far as what I'll support in the governor's budget, we'll see what joint finance comes out of it with, and see if I'm going to have to maybe I'll have to make some motions through joint finance as a representative to get stuff back in the budget, because they do have a tendency to, strip out, again, all the policy. And, there are some times when policy is attached to dollars, and then it's probably not a bad idea to put it into the budget. And there's also the ideas that sometimes if we put it into the budget, maybe they would vote yes on the budget, but they wouldn't vote yes on the individual bill. So I don't know. I'll wait and see what joint finance crafts out of that, and if we have to make some motions, and you're all welcome to contact our office. And if you see something that's been removed and want to put back in the budget, by all means, contact our office. And I always rely upon professionals. I am not a counselor. I'm not a psychologist, not a psychiatrist, but I know people. And all of you, I consider to be assets to help me to do a better job at getting the services for the people of Wisconsin.
Well, yeah, thank you, Representative. We're fast running out of time here, and I did have one kind of final lightning round question for folks to weigh in on. And I'd like to start with you first, Representative Tittl. What is the most important impactful action that can address the mental health crisis right now?
More, I guess, if you were to say it in one sentence, getting more people to be in the field of mental health, whether it be counselors, whether it be therapists, whether it be psychologists, whether it be psychiatrists, is getting more people so that we don't have that big distance between the time when somebody says, yes, I want to get the help, and the time that they actually start getting the help. Because I think that there's a crucial time period in there where we can lose some people, and we have.
Thanks. How about you, Mary Kay? What do you think is the most important and impactful action that can be taken now?
Well, the silver lining of the pandemic has been that everybody's suddenly become aware that their mental health is a part of their overall well-being, right? And so now we need to figure out how we can provide that healthcare, and should be healthcare. I think we struggle a lot because we have health insurance and we have all sorts of gaps in providing healthcare, and it's not truly healthcare. But I'm just excited that people are aware it's a year of mental health. Let's make some smart, humane decisions and acknowledge that your mental wellness is a huge part of your overall well-being. And I love, Linda, your statement that connection is a vitamin for the brain. I'm going to steal that. Okay.
How about you, Dr. Perez? What do you think?
I agree with all of the above. I think two things. One is really, I was thinking about the comments about peers, growing that more, really incentivizing that and growing the pipeline to train, peer support specialists, and in particular, also peers in the youth peers, and really view peers as the next wave of subject matter experts, right? Because they're the ones that really know what it is to struggle with these kinds of things. So, and all of it is important, right? School-based mental health, certainly all of it is important. And QTTs, all the issues we talked about today, but let's find a way to support efforts that bolster peers, both in the adult realm and then in youth.
Thanks. Amy, how about you?
So I would say that we need to treat mental health like health, and that if there was another health condition that was in the state that mental health was in, we would absolutely be responding to it with a greater sense of urgency across the board than we are now. Although I do want to give credit where credit is due, because there are many places where there is a sense of urgency, and we can't ignore that. So we just need to build upon it. And if I had to pick an issue that we could all solve successfully together, it would absolutely be workforce.
Linda, we'll give you the final word.
Thanks. It's an honor to get a final word off of this panel. It's a really great panel. I support everything that others have said, but I'm going to come back to school mental health. I think just the importance of growing youth peers, of supporting staff. This is no longer an issue where schools and school staff are saying, don't give us one more thing to do. We hear school staff and teachers saying, kids are coming to school with such severe trauma and issues that they're dealing with that we need help. We need space to address mental health and work with them, and we need the training to be able to do that. We also know, we have data from schools in Wisconsin that when you address school climate, the behavior issues go down, which leaves more time for learning. And we know that kids don't learn well if they are having mental health challenges and they're not able to develop trusting relationships with their teachers and their peers. So just critical of something as we can do right now as we are addressing all these other issues.
Got it. Thank you, Linda. And thank you to all the panelists for participating, to the sponsors as well. Our next event is with the CEO of Rogers Behavioral Health in Madison on April 11th. So another mental health themed event. And thanks everyone for tuning in, and have a great day.
Thanks for having us.